Welcome everyone, and welcome to this webinar, Behind Closed Doors, Resiliency of Trans People Amidst COVID-19. Just before we get started, this is something that we do in Australia. We acknowledge the traditional owners of the country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to their elders past, present and emerging, and recognise any Aboriginal or Torres Strait Islander peoples with us today. This webinar is part of a series being run by the ASHM Bloodborne Virus, Sexual Health and COVID-19 Regional Advisory Group. And this group comprises 70 members across the Asia and Pacific region, including the Asia Pacific Transgender Network, or APTN. APTN is a regional trans-led network that is working towards the advancement of trans rights in the Asia-Pacific region through research and evidence generation, legal, policy and programmatic advocacy, and public campaigning. And ASHM is very pleased to collaborate with APTN on this webinar. I'm Dr. Darren Russell. I'm the Director of Sexual Health at Cairns Sexual Health Service in North Queensland and an adjunct professor of medicine at James Cook University. And my co-host is Joe Wong, representing the Asia Pacific Transgender Network. He's the executive director there. It's important to recognise and acknowledge the input of so many members of the regional advisory group, the cluster groups, and people from affected communities and populations who've contributed their lived experience, which is really critical to informing our work here today. And there's just a few housekeeping rules to note before we start. This webinar is being recorded and it will be available, made available on the ASHM Task Force on BBVs and Sexual Health and COVID-19 web pages for those who can't join us live today. Just please keep your microphone on mute, but your video can be kept on if you prefer or not, that's up to you, but please keep your microphone on mute. And there's a chat function. You'll see that little chat button down the bottom of your screen. You can use that to ask any questions. And Joe and I will be tracking these and asking at the end of the session. You're welcome to send a message to everyone as a group or to someone privately or to us privately, and we'll be happy to try and answer those questions if we can. The webinar will run for 90 minutes and we'll have to finish on time. We have action for trans depathologization. We will be reflecting on the health practices, policies and laws that continue to deprive trans people access to gender affirming and general health care, and to live authentically as their true selves, especially in times of the COVID-19 pandemic. We'll introduce the speakers and get going. We've got a panel of great speakers, and they've all been heavily engaged in the response to COVID-19, which has turned the whole world and our communities upside down recently. We've got our moderator today along with Joe, and our moderator is Gemma Samitpol of the IHRI in Bangkok. I think if we get started, I think I should be one of the first speakers, first cab off the rank, or do we hand over to Gemma at this stage? I hand over to Gemma, I think. Are you there, Gemma?
Hello, everyone.
Thanks, Joe.
Sorry, I'm just changing a laptop, so I'm disoriented a little bit for now. Hi, thanks everyone for making time on this very, very busy day to join us on this webinar. Very nice to see everyone that's joined. We might be expecting more people, we don't know, but we won't delay the webinar. We will just go ahead. Some of you already know, or many of you know this, that today is the International Day of Trans Depathologization. And it's been a while since the diagnosis, the trans-related categories have been removed from the International Classification of Diseases, which has been an essential effort of like many organizations around the world in trying to fight for depathologization. And it's not something that just happened overnight. It has been a constant battle for several decades, and we've only seen victory in the past 2 years. However, having it being removed from the international classification of disease, it's just the first step to many, many other efforts that needs to be done. It is much broader than strongly affirming that being trans is not a mental illness. It also encompasses a range of social and legal changes, allowing trans people to live authentically as themselves, being able to express who they are without fear of being murdered, without fear of being beaten up, and allowing them to self-determine their gender and be legally recognized as a rightful citizen in their country, and to freely access their rights, such as accessing healthcare, accessing humanitarian support, accessing relief programs. And we have seen how this exclusion of recognizing trans people legally in their country has led to them being excluded from humanitarian relief program during COVID times, and it has been exacerbated, and it's more glaring than ever that the policy continues to fail trans people in spaces. There are not enough agency around government workers. There's not enough agency around healthcare workers that could step up to meet the challenges that trans people are experiencing right now, and the lack of support they have within the healthcare system that still continues to fail them. So today's webinar really is to we have a really great list of speakers on the webinar that's going to share with us different country examples from South Asia, Southeast Asia, and I don't want to be politically wrong by saying Oceania, so like from Australia and Aotearoa as well. Would hear examples from there. So now I didn't want to delay this further, but I thought I would like to also share what we've recently found out over the last 6-7 months when COVID happened, what we did during that period to find out how COVID has impacted trans individuals at that time. I would, so behind the scenes, I also just want to acknowledge my colleague Rain and Co, who is helping, like, and Anne as well, who's helping at the background, trying to do the technical stuff so that we can run this webinar very, very smoothly. Just need my slides up there if someone can. While we are waiting for them, if anybody have questions, please put your questions in the chat box there. Do indicate who you want to answer this question. If you have a speaker that you're directing this question to, do indicate their name and then your question. And Rain and Co will consolidate this question that we will get to us at the end of the, close to the end of the panel. We did something between, I should be more specific. We ran two different surveys. We wanted to see what's happening with individual members from the communities, but we also wanted to know how COVID has affected organization. And lots of them don't even have basic support, such as to the basic hand sanitizers, masks, and stuff like that. These were really basic things, but borders were closed. That's, you know, like, that's why we want to have a conversation what's happening behind closed borders. We don't know what's happening, and there's no way we could do it traditionally like we used to do, where we would be able to get ourselves on a plane, enter into a country, speak to people on the ground what's happening. So this is our way of trying to find out and learn from each other what's happening behind closed borders, and to learn what have shifted since COVID first started till now. I wouldn't even say this is post-COVID time. I think no one is certain what's going to happen. So if we, who's controlling the slide? Cole, second slide, please. So what we found out, like, these were the things that trans people were mostly impacted by during COVID. A bit slow, sorry. Lack of basic necessities, that was the largest thing that came out when we were speaking to trans community person from the ground. And then the second largest impact was actually the access to healthcare services, followed by the economical vulnerability. Lots of them lost their job, and as we know, there are several trans people, if not all, that are working street-based work or informal work, and COVID has really impacted the way in which they operate, and they lose their job as a result of having to be quarantined or to be locked up. And there were people who were locked in a really small space of like 1 by 1 meter room with lots of people in there, because that's what they could afford, and because that they are staying in community housing, which are not safe. Also, when COVID happened, they were just not sanitized the way it should be. And at the same time, there were shifting of priorities in terms of funding groups, organizations. Many funding started shifting towards catering for COVID-related fund, or people are drawing out their funding because they don't think that it is possible anymore to implement anything now that COVID has happened, or that it has become a less priority for funders and donors to fund trans movement at this time. There were also lots of barriers to trans organizing. People were scattered, people were afraid. And so we saw like there was some disruption in the way trans people have organized, because primarily because funding was reduced significantly from their organizations, and they were already working on a voluntary basis, and trans people were stepping up, offering their own salaries to provide community relief packages as well. And I think one thing I want to highlight is during this time while COVID is happening, our government is still not leaving trans people alone. People are introducing more regressive policies for trans people. And Ko, if you would just go to the next to the case study. So this was one of the in Indonesia, there is a current bill that violates rights of women, religious minorities, and LGBT people, as well as their freedom of speech and association. They cannot be out speaking or assembling together. And this is during the time of COVID-19, where parliamentarians are secretly pushing for bill to be discussed. And it is approved because no rallies are allowed. And so they managed to do this very well without resistance, because there couldn't be resistance because nobody could go out because they would be caught on the reason that they are not adhering to like the principle, the law on no going out of their house because of the quarantine. So this is just a rough snapshot of the region, but now I will not take up much more of your time. I'm going to pass this on to the other panel moderator, Gemma. And again, thanks again, everyone, for joining this call. Now I'll pass over to Gemma to moderate the next panel.
Thank you so much, So, and welcome everyone to the webinar today. And I'm so honored to be here with you. Let me introduce myself again. My name is Kritima Samithon, or many of you know me as Gemma. I'm from the Institute of HIV and Research Innovation Thailand, and we have the topic today of the COVID-19 and its social, economical, health rights, and organizing impact on trans people. And we have lots of panelists from different countries in this region. The first person that I'm going to introduce and to speak today is Rukshana Kapari from Trans Rights Collective, Nepal. Rukshana, are you here? You ready?
Yes, I'm here. I'm ready.
Thank you. Rukshana, we often heard that Nepal is one of the most trans-friendly countries in Southeast Asia because you have the legal gender recognition law. And what does it look like, and what is going on? What's the situation in Nepal, especially during the COVID-19 era? And does it help to have that legal gender recognition law in the country?
Thank you very much. I as a trans woman living in Nepal often hear this question, often hear the statement, oh, Nepal is a very trans-friendly country because now it has all the sorts of legal mechanisms for gender recognition and blah, blah, blah. And a lot of people like quote the landmark decision, the landmark verdict of 2007. However, I'd like to draw attention of everyone that however it's being portrayed out there in the media, however it looks like they're outside is not the actual reality. To sort of summarize in very, very, very brief, Nepal has one of the most rigid laws when it comes to all different details that you have on papers. So there's a requirement that every newborn child gets a birth certificate within 30 days of their birth. If you cross the 30 days, then it's gonna be very difficult to get that. So once you get a birth certificate issued, a name and a gender marker stays in the birth certificate. When you go to a school, you must present the birth certificate, and without the birth certificate, you will not be enrolled. Whatever details goes into your school will be picked up from the birth certificate, and it cannot be different or incongruent from that. Which means after you pass the school, you will receive your educational certificate. That's definitely what's written on your birth certificate. And the age of 16 is the age when you're eligible to receive a citizenship certificate in Nepal. And that means like when you have to apply for a citizenship certificate, you must present your birth certificate and your educational certificate, and all the details must be congruent in those certificates, and then your citizenship certificate will be issued in that name and gender marker. So now, so citizenship is like everything in Nepal. Like if you want to get a passport, if you want to buy a house, and as simple as if you just want to get a SIM card, you need your citizenship. So saying that citizenship, like it, so to have gender recognition, it really depends on being able to, sort of amend and like correct these certificates. So you can't just like say apply for citizenship while you're at the age of 16 and say, oh, okay, my birth certificate has this name and gender, but I'm this and I would like it different. You can't do that. You must like, sort of like have it all the same. And gender recognition in Nepal really depends on being able to amend those certificates. Now, a lot of people always quote the 2007 landmark verdict, which is often very which I would say has a lot of complex legacy. It has a lot of positive aspects, but it also has a lot of negative aspects. And the negative aspects are not often discussed. The landmark verdict did help establish that being transgender is natural. So that's when like the Supreme Court said that its gender identity is a subject of self-determination, and then like the gender diversity is natural. However, the verdict also helped to add a third gender option. However, there were a lot of different drawbacks when it came to sort of the interpretation of what the third gender means. Ministry of Home Affairs interprets third gender is LGBTI. So if you're LGBTI, it means third gender. If it means you're third gender and you have to like have a third gender citizenship. So if I'm a trans woman and I want to have female on my citizenship, it's not possible. I must choose others or third gender option, which is like which is one of the very, very, very significant drawback of the 2007 landmark, because it was coming from a very Hindu and very religious perspectives that brought in a lot of like the third gender culture kind of stuff, which sort of did establish a third option, which is great. But then it became an enforced, or sort of it became of mandatory or obliged for all like trans and non-binary people to enlist themselves as third gender. Now saying that, being able to change, because again, like everything must be congruent with your birth certificate. So being able to change your gender marker even as a third gender means that it requires to access a lot of loopholes, and then all these different documents like the birth certificate, educational certificate are governed by some acts and laws, and none of these acts and laws have any provisions that like say anyone can change their name or anyone can change their gender marker. So it really depends on the implementing authority, or if you know this person, if the person is a relative, or if this person is very kind-hearted. It really depends on accessing loophole. So now saying that, this statement that Nepal is one of the most transgender friendly country, or Nepal has all measures of legal gender recognition, is false. It's incorrect. It's not true. And I am really not sure why the international media is portraying like a very shallow and a very not going into details, not listening to the trans people in Nepal, and just like making statements just because there was a verdict in 2007. Now saying that, the citizenship bill is being amended. The amendment bill is registered in the parliament, and a committee has, the related committee has made a decision regarding the bill, and it's like yet to be passed in like the lower house and goes to the upper house. Now, saying that this Citizenship Act tries to bring a provision regarding gender and name change. Initially, they only told like gender can be changed or not names, but later like they also put gender and name. However, they are trying to limit this to a third gender option, so you can only change it from male to female to third gender, and not from male to female or female to male. And what additionally, so originally the bill had only this provision, and after it passed from the committee, it also include another very problematic clause that acts like, even to put yourself as a third gender or to change your gender markers and name, one must present a medical certification. Now, we have released a lot of different statements and worked with the parliamentarians to remove this, to abolish this, because although like a lot of different like Supreme Court verdicts have always held that gender identity is the subject of self-determination. So in terms of Nepal, although I still feel that the Supreme Court verdicts are yet not enough, because it only revolves around third gender, and it sort of does not acknowledge that like trans men are men, trans women are women, and then like different non-binary gender identities exist who would not like to categorize themselves as a third gender, which is a very monolithic idea. So sort of like but yet, despite its limited scope, the Supreme Court has always held gender identity as a subject of self-determination. However, the parliament is gearing up to like pathologize trans identity, and today, Trans Rights Collective as well as Queer Youth Group published a statement and sent it to all the government authorities, media, etc., like calling out this medical certification as an attempt to pathologize trans people and our identities, and we want it removed. We're also doing a campaign called the Year of Action for Gender Recognition and Against Forced Others Gender Labeling, Forced Third Gender Labeling. And this is a yearly campaign that goes around a Nepali national calendar, and it's the year 1141. Now, saying that, what does Nepal take a stand with regards to trans people and pathologization?
We're running out of time.
Sorry? Hello?
Please.
Okay, so with regards to what the medical council in Nepal takes the stand on transgender people, it's yet unclear. We've tried to actually reach out to the medical council. We've like texted them and we've sent them a lot of letters, but like there's no response. And of course, like the government websites in Nepal are unreliable for anything. So we're yet not clear about like the medical council's like official stand on like trans people and our identity. So with regards to the gender affirming healthcare services in Nepal, there are like hormone available in Nepal. However, like it's most of the medications in Nepal come from India or other countries. It's not like produced in Nepal. So during this time of COVID and lockdown and closing of international border, there is a lot of crisis regarding hormones. There are endocrinologists in Nepal, and not everyone is sure about like these doctors, how they are. There are very few doctors that are recommended regarding the hormone prescription, and so a lot of trans people actually choose to self-medicate rather than going to a hospital and getting them tested. However, like seeking for a hormone therapy does not require pathologization or a diagnosis kind of thing. You can just you can book an appointment and you can get prescribed and start medications. That's quite easy. However,
thank you so much.
Yeah.
Thank you. We're running out of time now. Thank you so much for sharing the situation. Yeah, thank you so much for sharing the situation from Nepal. No, I don't hear that. Thank you so much. And we hope that the movement to change the gender legal recognition law in Nepal is going well. And then if anyone at all has any question to Luciana, please feel free to type in the chat box, and Luciana will be answering the question from there. We're going to move on to the next panelist, which is Dr. Darren Russell, adjunct professor and Director of Sexual Health from Cairns Sexual Health Service, Australia. And Dr. Darren is also from James Cook University. Dr. Darren is going to be talking about COVID-19 and the trans community in Australia. Dr. Darren, you have the floor. Thank you.
Great. Thank you very much, Gemma. So yeah, I've only got 4 slides on here, so it's not a big presentation, but I just want to talk a little bit about what's been happening in Australia with regards to COVID-19 at the moment. I've just done some informal talks with people around the country to try and get an idea of what problems are occurring now. Next slide, please. I think one of the most serious changes has been in terms of people losing work, losing their jobs, losing income. And this is for trans and non-trans people. It's been a big problem, obviously. A lot of jobs in the hospitality industry and tourism have been lost. And some people had to stop studying at university as well. So many of those young people have had to return home to live with their family. And that has caused a lot of problems for many transgender people who moved away from the family, but now have to move in for economic reasons. So some people are reporting that their family is not accepting of their gender, not using the correct name, all these kind of problems, which has been very traumatizing and difficult. And I think of all the people I spoke to, I think this was perhaps the #1 problem that they had was those individuals who've had to move back home again. Next slide, please. With regards to medical problems, there have been difficulties accessing medical clinics. Some general practitioners, where a lot of the hormone prescribing occurs in Australia, and hospital clinics closed for a period of time because of COVID, or they were very difficult to get into. Some offered telehealth via a mobile phone or webcam because the doctors didn't want to see people face to face because of COVID. But sometimes telehealth using a webcam doesn't suit everyone. Some people don't feel comfortable with that technology or with seeing themselves on camera, and that wasn't ideal for a lot of people. So there were real concerns that some transgender people would not be able to get their hormone prescriptions and continue their hormones. Also, I put in here, elective surgery has been postponed or cancelled. A lot of hospitals around the country stopped doing surgical procedures that were not deemed absolutely essential because of COVID. And this also caused a lot of stress. We had people who were just about to have chest surgery or genital surgery of some sort, and suddenly they were not able to get that surgery because the hospitals were not doing it. So there were delays, and this was very stressful for people around the country. Some people had been waiting a very long time, saved up money, and suddenly couldn't get the surgery done. So that was very difficult. Also, of course, many transgender people in Australia travel overseas to access surgery, and Thailand is one of the main countries people go to. And of course, our government is not letting people leave the country or come back. Our border is closed because of COVID. So it's very difficult to leave the country. That can cause a lot of difficulties as well. Once again, people have saved up money, taken time off work, prepared to travel for surgery and can't do it. And we're still seeing some delays even within Australia now for surgery. Next slide, please. I think this is the last slide coming up. Yep, this is just about our service in Cairns. We're a sexual health clinic in the north of Queensland at the top of the country, very tropical. You can see I'm wearing short sleeves. It's a tropical country, very relaxed up here. Our own service did offer telehealth. Some transgender people were afraid of coming in because of COVID. They didn't want to sit in a waiting room with other people. So we offered telehealth, but we also saw face-to-face consultations. Demand for psychology services was very high. A lot of anxiety, a lot of stress that people were feeling because of COVID, because of work, having to move back in with families. So our counsellors were very busy during this time. The use of PrEP declined, and I think we'll hear more today about that. So for HIV, that declined, and our sexual health screens declined as well. So not so many people were getting screened. We're just about back to normal now. We don't have any COVID in our state, so medical services are pretty much back to normal, but it is still difficult for people to travel around Australia or to travel overseas. So that's all I wanted to say about COVID. I've been asked to say a couple of little things about ASHM as well. So one of the organisers of this webinar, their Asia and Pacific Introduction to Transgender Health and Care Training for Health Workers is still being rolled out in Vanuatu, Micronesia, Kiribati, Papua New Guinea. There's an Asia and Pacific Advanced Transgender Health Care training package for health workers. So we're putting together a package, and that's being developed at the moment. And we're hoping next year in October to have the first Asia and Pacific Transgender Health and Competent Care Masterclass. That's been sponsored by Gilead, and ASHM will be helping to run that, and we'll be looking to use a lot of people with expertise from the region to put on a masterclass, particularly for healthcare providers to provide better transgender healthcare. So that's all I have to say. Thank you for listening.
Thank you so much, Dr. Darren. Dr. Darren, can you tell us a bit about your telehealth services, please?
Yes, with telehealth,
Very interesting.
we made this available so that people could just use the telephone, or they could use their camera on their phone or their webcam, and we set up meetings with them. We generally have to use Microsoft Teams in our organization. They didn't think Zoom was safe. We found for people who are very good with technology, we found it was great. And a lot of the young transgender people are very good with technology. They're online a lot, and they know how to, they're better than me, I'm old, they know how to do these things. But for some older people, the technology is too difficult. They don't have the right mobile phone, they don't have a camera, they can't do things, and we found that was a big problem. So we tried to give people a choice. You can come in, you can have the telephone, or we can do a Zoom or Microsoft Teams meeting. And we think we might try and keep that choice going after COVID, because it suits people to have a choice. And in the old days, we told everyone, you must come into the clinic and the doctor will see you.
Right.
Well, maybe there's better ways, different ways of doing it. And I think we can learn a bit from these experiences.
Thank you. I'm very glad to hear that you keep all those services even after the COVID-19 era. Thank you so much, Dr. Darren, for your presentation. And we're going to move on to our next panelist now. Please welcome Dr. Aleka Walter from Indonesia. Dr. Aleka Walter works for GWL-INA, and Dr. Aleka is going to share with us the situation of the trans people in Indonesia. Dr. Aleka, the microphone is yours. Thank you.
So allow me to share screen here. Can you guys see my slide? Yep.
Yeah.
Can you see my presentation?
That's perfect.
Okay. Thank you for the opportunity. My name is Allegra. I'm representing GWL Indonesia. So there were two things that I would like to discuss today. The first one is the impact of COVID-19 pandemic to transgender population, especially in the healthcare perspective and the interconnectedness with other aspects in life, and also the recommendations and lessons learned from Indonesia. So we see that pandemic affects everyone, but the effect is not the same from one community to another. For example, in the transgender community, in this case, we have the legacy of adversities in terms of economic status, health disparity, and other challenges as well in the education spectrum, employment, social, and also social rejection. And this creates challenging health outcomes during this COVID-19 pandemic. I think this is in line with the presentations earlier that the first one we can see from the barriers to gender affirming and general health care. We've seen a lot of delayed care in terms of non-emergency cases. For example, if you're planning to having surgeries, poverty suppression, and other basic care. In Indonesia itself, if there is a lot of quality concerns in terms of surgery, in having surgery in Indonesia for top surgery, breast implant, or even sex change. So most of the trans population here, they prefer to travel to Thailand. And now we don't really have that much of traveling. And also we need court permission in terms of changing legal gender marker and also legal name. And this creates more disparity in health access, which a lot of trans people already face a lot of stigma, discrimination, and even abuse and health, and also sexual violence happening in healthcare spectrums here. And this also creates the impact on social isolation, as what Dr. Darren mentioned earlier. Most of the trans people, they don't really have support from their family, and sometimes they have to move back to their home or being very much with their family all the time, and this diminishes the access to social support networks that they have. You cannot meet friends unless it is online. So this creates more mental health challenges as well. And also, ironically, we're still facing violence, stigma, and discrimination. The latest research from UNAIDS in Asia Pacific, 1 in 3 participants receive this kind of treatment, and also 19% young people populations receive gender-based violence, which were 40% of them were LGBTIs. And the impact of COVID-19 in Indonesia, we have a great research from the Indonesia Transgender Network, or GPID. Thank you, Rebecca, for giving me this. So COVID-19 affected every aspect of life, but we can see from these 4 main aspects. In terms of income, we have lost more than 50% of income. And even if someone is trying to get like a COVID-19 relief support, sometimes they get discriminated because they don't have the right IDs, or even just blatant discriminations because they look different. And also violence, ironically, these were coming from the security forces. So if you are aware, since 2016, after the US Supreme Court legalized same-sex marriage, Indonesia has what we call as the LGBT crackdown. So there's a lot of panic and also hate towards minority groups, especially the LGBT groups. And guess what? I mean, like transgender women are the main target because they were the most visible in this. And also for the healthcare spectrum, we can see that there is improvement in HIV care. We were being included with our national programs. Everything was going well with this part, but there is a significant lack of mental health and transition care. There is not much of regulations going on. We don't really have established clinic like in Australia or maybe any other developed countries. And I think these research are in line with other research as well from the Indonesian Positive Network. Almost more than 50% received severe impact, including trans women, and also the Sanggar Suara rapid assessment to around 640 transgender people in Greater Jakarta have lost their job. So in the midst of all the darkness, we see the light, and also the trans community's resilience and adaptability in this time of adversity. From the personal resilience part, we can see that a lot of journals stated that for the transgender population, especially those who are early in their transition, they have the ability to be on themselves and to focus on their gender experimentation. And also the support from the community. We see a lot of charities and donations coming in Indonesia, as well as Thailand in some of the articles that I read. And also with the US study, they found that around 64% had someone to care for them if they were sick, and 60% had some money to lend. So I think this is a good initiative coming from the community, and a lot of the events are moving online with the online social support groups and also webinars and other educational initiatives. And I think GW in Indonesia, we were very proud to have the first symposium in Indonesia that caters the need for GMP population. I think this is great, something that we can use and adapt during this pandemic. Everything is moving online. And also, I would like to give 3 recommendations here on what are the next steps towards handling this COVID-19 pandemic. The first one is, if you're fighting a health pandemic, it is very important to have equal access to health and protection. So the first step is we need to address the issues faced by the transgender community as well. Let's say in Indonesia, we still have a lot of stigma and discrimination in healthcare. We're still being pathologized by our medical professionals or other healthcare professionals as well. And I just want to highlight here that especially for transgender women, we have lack of formal documentation here for the national ID card and also national family ID card, because sometimes some of them were, they were being kicked out of their homes. So they don't really have these IDs, and it is very hard for them to apply for health insurance or even, register for formal work. And this creates more vulnerability to COVID-19 and other diseases. And I think we need consistent, clear values to affirm transgender health itself. And this needs to be reflected in our policies, knowledge, expertise, and training. We need sensitivity training and also the cultural humility training to train our healthcare workers to support trans health. So other than that, we also need public health research, because health is not health is only health. You can see that there is an interconnectedness with the economic status, work, education, human rights law. So it is very important to have more research into this. And the third point is that I think we need practical approach in terms of trans health initiatives, because this needs to be specific in each country. Although the challenges might be similar in Southeast Asia, but I guess at the end of the day, we need to tailor everything based on the situation that we have in that country. And we need more community-led initiatives, giving them the right tools to thrive. And also, one of the key points here is that COVID-19 makes us realize that there is a power in technology. And Dr. Darren mentioned earlier that they have telemedicine access, and also other developed countries like US, for the Fenway Health Institute, they have telemedicine as well. This can be something that is useful, because sometimes trans health care are not very well distributed in all the areas in each country. So, and also this can provide education and support platforms for trans individuals through websites or even webinars. The second point is that we need something that is very practical. We need crisis response mechanism. We are very fortunate to have communities.
We're running out of time. Yeah. Can you speed up, please? Thank you.
Yes, we have for communities. We raised around $25,000 US. These are coming in the form of food and hygiene packages, and we have to remember this is not thriving but surviving. But then again, for how long we can do this? For the long-term aspect, I think it's very important to invest ourselves in trans empowerment programs. I have 2 examples here from the International Labor Organization. ILO in 2016 study, they said that only 10% transgender persons work in formal economy. So they invest in the entrepreneurship training on this, which is very good. And also the Yes I Can program funded by the Voice Global. We have 3 core programs: reflective practice, professional training, and then advocacy to give them funding to run their programs, for example, like building salons and everything. And this proves that we need sustainable long-term multi-sectoral collaboration in this, because the issues that would be faced by trans population are not only HIV or other health aspects. It needs to be interconnected with the economic spectrum, education, work, human rights and law, and many other sectors as well. So my main recommendations in that is that we need practical short-term deliverables. We have to include trans community in planning, designing, and implementing what kind of initiatives that we can do here during this time of adversity. And we need community-led initiatives such as BCRM and also other fundings as well, if there is possible to relieve the current situation that we have. We have to use the online power as well, and also support emerging business creatives. For example, like I've seen trans women who used to work at salons, but now she tried to sell cookies, for example. That can be supported as well. And also long-term recovery should focus on addressing, empowering, and integration of all the aspects within transgender community. Thank you. If you have any questions, feel free to email me.
Thank you. Thank you. If anyone has any question, you can also type in the chat box so that Dr. Arika can come and answer the question. Thank you so much. We're going to move on to the next panelist, which is AR Arcon from Pioneer FTM, the Philippines. And AR is going to be sharing the situation with us, especially on the trans men situation in the Philippines. AR, please.
Hello, everyone. It's nice to see familiar faces. I hope my audio is okay. So hello again, I'm AR from the Philippines. I'm a trans person. I'm with Pioneer FTM. It's a local support group for trans men, Filipino trans men. And also I'm with Lacanbini Advocates Filipinas. It's a network of transgender organizations in the Philippines. And so our situation is our government imposed lockdown started in March. There was still a day gap between the announcement and between the implementation. So there were people who were able to go back home to the province. But then we I guess we all didn't see this coming. Like we all didn't expect this to be prolonged. Like we are still in lockdown up to this moment. So there were a lot of trans people that I've interviewed who got stranded in different cities because of the lockdowns. The lockdowns have varying degrees over time. It depends on what the national government announces every 15 days. The strictest is the ECQ, or the enhanced community quarantine, wherein there's curfew, people can only go out at certain periods in time. There were only one person can go out of the household to get the necessities. So only food businesses are open. There's no public transportation. Work is suspended. So imagine that for trans people, for everyone who's on no work, no pay situation. In April and in May, we already heard the cries of the community. Of course, we are only getting their situation from the social media. We are only getting their information from what we read on their social media. In June, thankfully, regional NGOs have already sending help. They started sending help. I was tasked to help coordinate the APTN Community Support Fund. So we were able to help trans people across the country. There were people, we put out the call, and there were people who are coming to us for help, and also those who have been referred to by the member organizations of Lakambini. But we were prioritizing some of those folks who are really needing help. So for example, we were prioritizing those who got unemployed because of the pandemic, those who got displaced because of the lockdowns, who are really needing transportation or accommodation at the moment, because they are like, some of them are already living in streets. There are also those who did not receive support from the local government because they were not considered as a household, just because they are trans people. And so there are some local governments who did not count them as a family because they're like, they were considered same-sex couples. So there are also those who need allowance to go back home, and we also prioritize those who need support for employment requirements. So we are hoping to help them get a new job amidst this pandemic. And then from these interviews and surveys, we also gather the narratives. I can give you some. I hope we have time. So the economic impact is, of course, there's impact on livelihood. It's hard to find jobs. It's hard to find jobs because of the new protocols related to COVID. That's the context. So less work hours, no work, no pay, limited to non-transportation. So imagine if you're just going to work using the public transportation, you can't. So people started biking. People are resilient. People find ways. But then again, it's hard, to cope up. And then all these happening while bills are still ongoing. There's no stopping the bills from coming. We've gathered also narratives of trans people being less prioritized during hiring at this time, because this is from the interviews, like, because they felt like they were told that they were different. They were not presenting in a way that the binary expectations of how a man should look like or how a woman should look like. And then also there's even one example of a trans couple. It's a trans man and a cis woman in a relationship. So they applied together for this new job in a factory, and then only the cis woman got hired. And then they got the feedback that because the other person, the trans man, doesn't present in a way that the company wants their workers to present themselves. So there was also a case of a trans person working in a small business. So the small business really got impacted that they had to lay off workers. And so when choosing who to lay off, this trans man was the one chosen because there was a feedback that among them, they were uncomfortable being with that person because the person is like different. This person, just for context, has not transitioned like fully, like to pass the binary expectation of how a man should look like. So the sad thing is he was the one who got laid off just because of that. There were also, as I mentioned, there were also trans households that were not considered as households just because they are like considered as same-sex couples. But the good thing is there are some cities who considered them as household, but with some limitations, like you have to have a kid in your name for your family to be considered as a family, things like that.
Thank you. Thanks a lot.
Time.
Okay, thanks for sharing the situation, especially for the trans guys in the Philippines and how it affected the cis people and the partners of the trans people as well. We're going to move on to the next panelist now. And we have Dr. Shamindra Virawachana from Vinasa, Sri Lanka here. And Dr. Shamindra is going to be talking about the COVID and the challenges for sustainability for trans people in Sri Lanka. Dr. Shamindra, the microphone is yours. Dr. Shamindra, are you with us? Okay, Dr. Shamindra might have some difficulty with the connection. Can we move on to Jack Byrne? Jack, are you ready? Are you happy to do that?
Yeah, that's fine. I'll just bring up my slides.
Okay. In the meantime, I'm going to introduce Jack Byrne again. I think it's not needed, but then again, I would love to do that. Jack Byrne is from Trans Health Research Lab and Transaction from New Zealand. And Jack Byrne is going to tell us what life is like for the trans people in New Zealand during the COVID-19 era. Jack, the microphone is yours.
Okay, can you see my slides?
Yes.
Yes.
Perfect.
Okay. Oops, I better go back one. So I'm just going to get rid of the chat box. Can you hear me all right?
Yep, that's great.
Okay, so I'll try not to take up too much time because there's so many wonderful speakers. The images I'm showing with our presentation have come from some research I've been a part of at the Trans Health Research Lab that we have here, that's trans community-led research, and those were done by an Indigenous artist, non-binary artist, Turiana Kopeke Ta'aho. And this is Ahi, who some of you may know from Gender Minorities Aotearoa, and very much a focus here on the importance of peer leadership. Yes. So the context we have here in Aotearoa, you know, this is a photo of trans pride. The poster you see in the background says trans people have always existed. We have strong history, ancestry around Indigenous identities that are gender diverse in Aotearoa. But partly because of what's happening internationally, but also because of our visibility, we have increased amount of backlash. So I just got it. And I focused predominantly on the access to gender affirming care because I can't take it too broad, but we've always here had, we don't have any insurance coverage. No insurance providers cover gender affirming care here. Most of our hospitals don't provide any except access to hormones. We do have access to hormones. And we've also got this increased demand. And then we've had reduced capacity. I don't know whether some of you heard about Whakaari. It was a volcano that erupted here about a year ago now. And so that's plastic surgeons who have looked after the people affected by that eruption. And so that reduced the amount of plastic surgeons available for people to see and the limited services that were available. And then of course we got COVID-19. And then we've also been in a context of a backlash. And I'll just share with all of you something we just found out in the last 24 hours. The one hospital in Auckland, our biggest city, that was going to provide lower surgery through our public health system. It's a very long waiting list, but it was finally going to happen. It's a Catholic hospital and it is now vetoed providing those surgeries because they don't want to support trans people. So we're back to the drawing board of trying to find a hospital. These are some of the, counting ourselves, that's the research that I was talking about. That came out in 2019, last year. The one before it is another one I worked on for our Human Rights Commission. And, that was 10 years earlier. And the sad thing that I just wanted to put here is, 10 years later, a lot hadn't changed here. So the research is hugely important, but it's not sufficient if there isn't a political will. And for a long time, we didn't have the political will, but we're lucky enough that we probably are starting to have that now, because we really, really need that evidence base. And we finally have started to we can put numbers around people who can't access care, people who are experiencing homelessness, unemployment, material hardship. We've finally got some of that data from these community-led studies, and we've been pushing on our official Statistics New Zealand to collect data, and we will finally have census data next year that will measure the experiences of trans people. The socio-economic impacts of COVID-19, lots are very similar to what other people have said here. I just wanted to emphasize that I think for our communities, but also other communities more broadly, it's shown where there are gaps. And even a country in New Zealand where we do have trade unions, we do have some forms of, a social welfare system for when people are unemployed, but it's really shown the vulnerability of people in the gig economy. Like lots of trans people who've struggled to get work, kind of piece together a bit of work here, a bit of work there, a bit of, a whole lot of casual bits of employment. And that if you don't work 10 hours a week in the same job regularly, you're never eligible for sick leave. And a lot of people haven't been eligible for sick leave. They've had no bargaining power. It was really unclear for a long time whether employers could get a wage subsidy, which is what we were lucky to get, that employers here got funded by the government to if they so they didn't get rid of their workers. They got paid some money to give to those workers, but it was up to the employer to ask for that funding, and lots didn't know that they could do it for casual workers or couldn't be bothered claiming it for casual workers. And lots of trans people work in sectors. I should have written in sex work. We had some wonderful posters all up around town about, particularly in community places, about, sex workers work and sex workers can claim the wage subsidy. So there was a very positive messaging out there that the protections that did exist for workers covered sex workers as well. A real gap is there's no targeted COVID-19 response for trans communities, and there was explicit exclusion from other forms of support, because a lot of the support that did come was available to permanent residents. It was the government differentiating between, tourists who were here, and then it was and migrant workers who were here. and people who were residents, and a real gap for migrant workers, but also a huge gap for trans asylum seekers and refugees, people who came here as asylum seekers and then were granted refugee status, so are allowed to stay here, but takes years to get permanent residence and having no access to support because of that. And we've got a rainbow refugee and asylum group here, and really we looked after each other. And that group has been under huge pressure at this time. And then, as others said, no recognition that trans people, if you didn't have kids, if you were seen as a single person, not recognised as a household, and really hard to get a food parcel. You might get one, but you wouldn't get another one. The health aspects, so the ones on the left-hand side, I've explained some of them, what the situation was like to begin with. And then things just became harder. Like, I guess I'm thinking a lot of the refugee and asylum seekers group that I know of, you know, other people were talking about isolation at home, and they were talking about having to go to work, having to take public transport, having no PPE in the casualised work that they did. And there was a real gap of visibility. And people feeling like they had to choose between their health and going to work because of the sectors that they worked in. Gender affirming healthcare services largely, stopped, and that continues. There's still lots of delays and cancellations and uncertainty. And one research, we've only, I love that other countries have research already. We don't, except for this one little figure we got about young people, LGBTQI young people, and over a third felt unsafe in their bubble, in the group of people that they were only allowed to stay with when we were in our biggest lockdown. And, we've had increased suicide attempts in our communities, and that's been really hard because if someone has made a suicide attempt, has gone to hospital, it's really hard to even go in and visit them because, different lockdown stages. And to be honest, quite a few of our community groups went and visited people who were really, really vulnerable, even though we were meant to stay in our bubbles because we knew they had no one else.
Right, Jack, we're running out of time, Jack.
Okay, it's my last slide. I just wanted to say resilience. Look, we've done some good stuff. We've created easy read resources we've shared with other activists, and I think some of the problems have become more visible, and we're really dedicated to trying to solve them, and we're putting some of them. We've got a professional association for transgender health that's trans communities and health professionals, and we're about to do a briefing to the incoming Minister of Health about the need for a national strategy. So that's me.
Thank you, Jack. Thank you so much. That was a wonderful presentation and talking and sharing for your experience and lesson learned from New Zealand. And I'm afraid Dr. Shamindra has some difficulties with the internet connection. So I'm afraid we might have to skip Dr. Shamindra and move on to the next session. But before we do that, I'd like to thank all the panelists for their presentations, their lesson learned, and their contributions to the trans community and to the society as a whole. And we love to see you again. We love to have more webinars like this, and we hope that can happen and that we can see you again soon. I'm going to pass this on to pass it back to Darren to the next session. Thank you so much.
Thank you very much, Gemma. That was fantastic. Great panel session there. Really interesting, different things that are happening around the region, but some of the same problems everywhere, I think. And when you have a marginalized community and something like COVID happens, the marginalized groups find it much tougher than the privileged groups. That's the same around the world, I think, no matter where you are. We've got a presentation coming up now from Dr. Nitya Panupak, who's the director of the Institute of HIV Research and Innovation in Bangkok. A lot of you would be aware of Dr. Nitya and the great work that she and her team do. And she's going to talk to us today about learning from COVID-19 to further optimize trans health. Thank you, Dr. Nitya.
Hello, everyone. Can I have my screen share? I can just share it. Okay, I can see that now. Do you see the screen? Okay.
Yes, Dr. Nitya.
Okay, thank you. Thank you. So it has been my great pleasure to be part of this webinar today, and I'm going to share with you the part which is more related to the health aspects of trans people during the COVID-19, since we have heard quite a lot from all multidisciplinary aspects from previous speakers. So please let me take you through our key model, which describes the key population-led health services that a few of you have already mentioned about the community-led or key population-led healthcare. And in this model, we use the status-neutral approach in which once we can get people into the healthcare system, we will provide active engagement to that person, regardless of the HIV status, in order to get to the final common goal of retaining them in the program with negligible risk of transmitting HIV because of U equals U, or negligible risk of transmitting, acquiring HIV because of PrEP and PEP as part of the combination HIV prevention message. And here we are going to talk a bit more of how we apply this key population-led health service, or the key model, in a trans-competent healthcare concept. And here you can see that in addition to all aspects of HIV, STI, and other sexual health, we are also providing more emphasis on the gender affirming health literacy, as well as gender affirming monitorings and counseling, as well as care, including both hormone and surgical care. And here is the basis of key population-led health services, in which we have this set of services designed by the key populations themselves. And in this case, it's transgender communities who design the services in order to ensure that the services are needs-based, demand-driven, and client-centered. And all these services are co-delivered by trans people who are members of their own community, who are then trained and qualified to provide these services. And this is just to give you an overall impression of how COVID-19 has affected sexual health services in Thailand. And here, what we can see is that the number of people newly diagnosed and a number of people who had ART initiation overall in the country dropped significantly during the first months of COVID-19 pandemic in the country. And as we already heard from a few other panelists, some people living with HIV cannot travel to obtain ART from their usual providers, especially those who migrate across countries or provinces. And with us being in one of the major HIV and STI centers, we have seen 50 to 75% decline in the number of HIV and STI testing, as well as PrEP supply, both from the generic and original companies, were quite uncertain during the first few weeks of the pandemic. So what we have quickly done is to make sure that we have a proper ways to communicate to our trans communities to ensure that we will try our best to continue the support and to provide services, even though those services may need to be adapted due to this COVID-19. So you can see here that we use the Facebook channel to ensure that our trans communities understand, realize, and follow the social distancing measures and travel restrictions measures during the first phase of COVID-19. But at the same time, they also know that they can always contact us through this trans health helpline. And as well as we immediately adapt PrEP service to become PrEP telehealth. We have heard about this from other speakers already, that we use the PrEP delivery through motorbike to mailing system to courier system. In addition to that, we then quickly adapt the services inside the clinic in order to ensure the safety of both the clients and the staff in the clinic, aiming at reducing as much time spent in the clinic as possible and reducing as much personal contact between clients and providers as much as possible through the telehealth that we already heard, as well as the express service, which we have tried to introduce and integrate into our services many months ago, I will say a year ago, but has not been very successful. But with COVID-19, it has been proved to be feasible and highly acceptable by both providers and clients. And the express service meaning that once the client come into the clinics, they can just drop their samples or do self-sampling for us, and then they can go back home, and the test results, either that be HIV test results, STI test results, or hormone test results, can be shared with them via line application or SMS. And the other measure that we have introduced during COVID-19 is self-sampling for STI, and this means sampling from oropharyngeal compartment, urine collection, and also anal self swab. And this is to, again, reduce the contact between providers and clients, especially for the oropharyngeal sample collection because of this COVID-19. And we have seen that this has proved to be very feasible and very popular. And you can see from the number here that even after the peak period of COVID-19, or we can say the post-COVID-19 in Thailand, in May, June, and July, you can see that the acceptance rate of people who agree to have self-sampling for STI increased from 50% in May to almost 70% in June and almost 80% in July. And we have seen very few invalid test results demonstrating adequacy of sample collection, but with very high positive rate for chlamydia and gonorrhea. So in conclusion, we have seen that because of the services built based on the key population-led health services concept, and since it was designed and co-delivered by key populations, the health system like this has high adaptability to emergency crisis. And we have proved that through KPLHS, sexual health services can be continued during COVID-19 and can even be used to further optimize the service. And for us, we feel that the telehealth, the express service, and the self-sampling will become the new normal even during the post-COVID-19 era. And I'd like to thank all organizations who support these activities in our country. Thank you very much.
Thank you, Dr. Nitaya. Very interesting. And once again, I think we're hearing about telehealth and interventions like your express services that may continue after COVID. And I think COVID has been terrible and caused so many problems, but it has made us look at the way we do things, and occasionally we've been able to come up with better ways of doing them, I think. So thank you very much for that. So that's the presentations finished now. We've had some great presentations, a great group of people presenting so far. We do have some more time for 10 minutes or so for questions, so type them up if you would like to. I've got a question here already, and Joe, jump in at any time if you see some other questions. I'm just trying to find. We had a question to the panel, just whether there are any national or local government initiatives during the time of COVID that have been aimed just at the trans or broader non-binary communities. So are you aware of anything that governments and local governments have done, national, local government, to improve things in this time? So I'd like to hear from any of our panel members if you can think of any such things, or if you can't. Jack, have you, sorry, Joe.
Now, I was just going to say, if any of the panelists wants to answer that, feel free to unmute any of the speakers, feel free to unmute yourself and answer the question.
Darren, I was just going to mention that, you know, I think AR put in there that sometimes just before elections, people start saying, you know, promising things. And it was interesting, our Rainbow Path group for refugees and asylum seekers, and it's just about all trans people, have been lobbying around legal gender recognition, something for people to have as soon as they get here, because it so affects your ability to participate in anything. And, you know, we keep getting fobbed off by different ministers or jumped between different government agencies. And we managed to, that we did get, our group got a little bit of funding from, there was a mental health grant to give to vulnerable groups to provide mental health support, and we got the smallest grant that they gave, but it was been really important for us. But what we found a bit ironic was that the government announced that in their rainbow policy as something that they had done. Well, it was no particular party that had done that had come out of the Ministry of Health. But also, you know, we don't want just handouts of a little bit of money that is never going to go far enough. We actually want the systemic issues that we've been raising in multiple forums to be addressed, you know. And I think I have a bit of a cynicism too, that, you know, there may be funding for COVID-19 projects, but all the other work we've all been doing, and the activists here have been doing all across Asia and the Pacific for so long, that work hasn't gone away, and that work needs funding. And when we do research, we need funding to implement the recommendations of that research. I'm just really cynical about project-based funding when there is so much structural reform that's needed in all our countries.
Yeah, thanks, Jack. I think you make a good point there that there's a problem appears and the government puts a little bit of money towards it, but it's a little pimple on the skin of that problem. That the problems are all there, and they identify some little thing that they can throw money at, but that won't fix the systemic problems. You're right. We have a question for Dr. Nitayar. If you're still there, Dr. Nitayar, how can you guarantee with these rapid screening tests that there are no invalid test results? Are the tests just as good as what you would normally do?
Mm-hmm. You are talking about the, I assume this is related to the STI self-sampling and STI testing. Yes, and if that is correct, yeah. So we are using the nucleic acid testing for that, and not the gonorrhea chlamydia rapid test, because we realized that performance regarding sensitivity and specificity of those rapid tests which are available in the market are not very good, and we all are hoping to get a cheaper point of care testing for these STIs in the near future. But the practice that I just described mainly just self-sampling, but we still use the gene expert machine in the clinic, either that at our anonymous clinic or at the community-based organization.
Great, thank you very much.
And we are also using the pooled strategies for those samples to save cost as well. That just small things to add.
How many specimens do you pool generally?
So we usually will recommend 3 to 4 compartments, samples from 3 to 4 compartments to be pulled together. And by our validation results, we right now use 1 ml of urine and then plus swabs from other compartments into 1 cartridge.
So thank you, that's very good. If you have other questions, please, any in the audience, please feel free. We've got another couple of minutes before we'll wrap up. There is a question, fairly long question, mainly for panelists with legal experience about trans empowerment, and that legal processes have been faster in some countries than in other countries, particularly those that have civil law jurisdictions. And the questioner, the person from the audience, is wondering whether any practical steps can be taken to build cross-border collaborations to improve this, to improve the legal frameworks within a country itself. Would anyone like to comment on that? Okay, it's
I'll just to comment.
Yeah, Allegra, maybe.
I would love to comment, but from the healthcare perspective, but I guess it's a bit interconnected as well with the legal aspects, right? Because right now in Indonesia, we don't really have any regulations in terms of trans healthcare. We do have good services for HIV and STIs, especially with the government clinics. It's called Puskesmas here, the private health facilities, and also some private clinics offering, especially in big cities, offering health, sexual health services. But for the trans health initiatives, it is very rare. We've seen several doctors in big hospitals that is usually affiliated with the university that they have. For example, here in Jakarta, we have ASHM Hospital. So it is related with the University of Indonesia. And I know that they do have several experts who treat psychiatrists, who treat transgender clients, and also some hormone prescribing physicians, mostly andrologists and also OBGYNs. I haven't seen any endocrinologists yet. So we don't really have these strict regulations. Most of the time, it is more of the willingness from the healthcare experts. So, but you know, I've seen even with the APTN report, I guess, reported by Ms. Dina Listorini with collaboration with GWL Indonesia, we've seen in the qualitative assessment, we've seen that there is a fear from the healthcare experts to treat transgender clients because they're scared of being quote unquote bullied by other peers who believe that trans people shouldn't get the right kind of treatment, or even from the extremists in Indonesia. So I think in this case, what kind of collaboration that we can have is that although we don't have like a specific clinic that treat or hospital that treat transgender people, but we have several experts that can be trained quote unquote formally. So I would really love if the Cairns Institute or even Tangerine Clinic open their hands to help the Indonesian medical professionals who are willing to learn more about trans health practices. I would love to connect that. So at least if we don't have like a clinic, we can have like a proper referral network. And I think I want to highlight here that it is very important for us to have community initiatives. So we've seen even with in the UK or US, we've seen transgender people self-medicate, even if they have like a good healthcare system, there are still barriers. So I think at this point, we can think hormone education as some sort of like a harm reduction, because I mean, like the Indonesian doctors knows that a lot of transgender people, they self-medicate, but then again they are not willing to give the right treatment to them, and there is a lot of bias when it comes to comparing transgender people and also intersex people. Let's say intersex people, we're being said that they are legitimized to express the gender that they want because they are in the middle, quote unquote, but trans people do not. I think these are the stigmas and also discrimination that kept on happening, and we need to address this not only on the national level, because sometimes it is hard if you live in a very like a quote unquote religious country that is not very supportive. Sometimes you need support from the international organizations and also neighboring countries as well to show that there is a need for trans health competency, and I'm sure that we can provide better quality if we have stronger collaborations and also stronger trainings as well.
Okay, thank you, Dr. Allegra. Good points. I think we'll have to wrap it up there. Sorry, Jack. I think we're going to run out of time. So I might hand over now to Matthew Avery, who's the Regional Associate Technical Director for Family Health International 360, and he's going to give us some key insights and takeaways from the region. So over to you, Matt.
Thank you very much. And I wanted to start by thanking APTN and ASHM for inviting FHI 360 to provide comments at the end of this really valuable webinar. And I especially wanted to thank all of the presenters this afternoon for sharing this wealth of extremely valuable experiences and insights. I was asked to try to sum up those insights, which feels like a bit of a daunting task because I'm not sure I can successfully boil down the many, many important points that were made into just a couple of minutes of summary, but I'm going to give it my best shot. And I do think there were a few things for me over the last 90 minutes that really resonated sort of over and over again across the different presentations. The first one of those was this idea of what I'm going to call interconnectedness and intersectionality. And by that, what I mean are the ways that economic vulnerability, health disparities, access to education, access to employment, and what we've seen is a really troubling backsliding across the region into some regressive politics and policies. The way these interconnected intersectional issues have been impacted by COVID-19, the way they have exacerbated, the way COVID-19 has exacerbated existing vulnerabilities, and the impact that that has had not only on HIV outcomes, which is my primary professional area of work, but really the intersectional impact of COVID-19 on health and wellness much, much more broadly. And even on, as was stressed, the ability of members of the trans community to access even just basic day-to-day necessities. And I think that this is a real message that needs to be repeated over and over and over to governments, to donors, to programs like mine, where we need to be considering how we address needs and vulnerabilities that are defined much more broadly, that they are usually defined in the more siloed program approaches in which we most often work. So I think that was the first message that I heard over and over again from speakers. Happily, the second message that I heard being repeated was this idea of adaptability and resilience. And that in the face of these really, really daunting challenges, that we have seen impressive resilience and inspirational adaptability from individuals, from trans communities, and also from community-based and key population-led organizations around the region. And as I say that, I did want to note, and I believe it was a comment, I think it was possibly Jack who made this comment, or maybe I'm misattributing it, but I did want to emphasize this message that that there's not a one-size-fits-all solution. And while we have shown examples of adaptable models for service delivery under COVID-19, there is a need to remember that there's not one solution that's going to work for everyone, and we need to be looking at different ways to reach people and meet their needs. Having said that, we saw very clear evidence of the absolutely critical role that community-based trans organizations play in addressing a lot of these vulnerabilities and making sure that these needs are being met. I think Dr. Nitya's presentation on the KPLHS model is just one example of the many ways we've seen across the region that communities are stepping up and meeting these needs. I mean, that is inspirational and that's hugely important, but for me, it also highlights a vulnerability. And the vulnerability, as one of the speakers stressed just a few minutes ago, the vulnerability is in the funding for these organizations, especially when that funding is project-based or performance-based. And when there is a disruption to that system, and the very vulnerable position it then puts community-based organizations in. So I think that for governments and donors and organizations like mine, there's a need to put a lot more focus on how we build sustainable financing mechanisms for these community-based partners that are not so dependent on a single siloed project. And part of the reason I stress that, and this is the last point that I will make, is that what I heard from many of the speakers is that we have real lessons learned over the last 6 months about how to reach trans populations, how to serve them with HIV services, yes, but with services that meet a range of needs. And for trans populations, but also for other key populations and vulnerable groups. And what we don't want is we don't want to backslide. Where we have had successes, we want to see these successes carried forward and sustained, even as COVID-19 starts to recede from memory. Both because these are standards of practice that will allow us to better serve trans populations going forward, but also because, frankly, we don't want to have to relearn these lessons again when the next pandemic inevitably arrives. So we need to be thinking about how do we make sure that lessons learned are sustained, are built into standards of practice, and that we are ensuring the sustainability of the organizations that deliver these services so that they can carry these innovations forward. I think I will leave it there. I know we're already over time, but enormous thanks to all of you for listening and to the organizers for giving me the chance to share a few possible chief takeaways from this very, very valuable webinar.
Thanks so much, Matt. A great summary there. And with that, I think it's the time to wrap up now. So certainly on behalf of ASHM, I would like to thank all the speakers and panelists today. You've been wonderful, very interesting. I've learned a lot. And also thank you so much to all the people who've worked behind the scenes and have been working during this to make sure it all has gone well. So I thank you. Please feel free to contact me if you have any questions. I'm a cisgender male clinician working in transgender health and sexual health for 30 years. Happy to talk to anyone who's got any questions, or if I can learn from you, that'd be great too. So with that, I'll hand over to Joe to say goodbye to you all. Joe.
Yeah, I'm here, sorry. Like I said, I'm cranky at the beginning because I haven't had lunch. But thank you everyone again for joining us on the Behind Closed Borders webinar. We've really learned a lot from all of you. I think I want to acknowledge too that there are definitely conversations that are missing today. We know it's not easy for trans people who are already citizens of the country, and the situation is harder and harsher for migrants, asylum seekers who are now in a state of uncertainty, and people who are facing religious backlash. And I just want to acknowledge that this is really difficult time for them, and this webinar really is to understand now what's going on and what else are we not talking about or thinking about yet. I also picked up something that Allegra mentioned earlier. We are surviving, not thriving. And I think I would like to end it there. We are surviving, and I think there are so many more things that needs to be done on this front in order to help the trans community thrive, and so that we reach the point whereby trans people could live freely and authentically as themselves. So I'd like to again thank the speakers and the participants for staying with us on the webinar. I'd like to thank also ASHM for this collaboration and FHI 360 for Matt. Thank you for wrapping it up with us, and my very wonderful moderator here for taking on moderating our panel. And with that, I'll thank everyone again and have a good day.